And over 17 million more American kids are now eligible for the COVID-19 vaccine. But a survey taken by the Kaiser Family Foundation before FDA authorization and the CDC recommendation said that just 18% of parents are eager to get their kids under 5 vaccinated, and 27% say they will definitely not get their child vaccinated. More than half of parents say that they're still unsure about whether or not to get their young children vaccinated. So let's bring in ABC News contributor and physician at Stanford Children's Health, Dr. Alok Patel, who's here in studio with me for more on this. Dr. Patel, you're there, you're treating these children. What are you hearing from parents now that this ability to get the little ones vaccinated is here?
Well, simply put, Diane, there's a spectrum out there. There's a combination of parents who say, I can't wait. We've been waiting for this moment. We feel like we've been neglected. Let's get that shot. Then on the other end, there's parents saying, we're not comfortable. We're not getting it. But I think it's important that we talk about that middle. We always talk about this Kaiser Family Foundation study saying 20% of parents want to get it. In that survey also are 40% of parents saying, hey, they want to wait and see, and 11% saying, you know what, we'll get it if it's required. To me, as a pediatrician, that says 50% of parents might be vaccine hesitant, and that's okay. That's a population that we can reach if we simply listen and we have those conversations. And the one thing that I would never want to do is alienate vaccine hesitant parents or say, you know what, they're anti-vaccine. That doesn't get us anywhere. We need to make sure that we're having that respectful dialogue. Parents out there should be empowered and encouraged to go and talk to health professionals, and we should be ready to listen.
So let's talk about that for a second, because you do often hear terms like anti-vax, but a lot of these parents, their kids have the measles vaccine, the mumps vaccine, the chickenpox vaccine, rubella, etc., right? So they're not anti-vax, but they're hesitant about this vaccine specifically because it's new. So if you are one of those parents who just has these questions, has these concerns, this is an area that can feel a bit shameful because so much of this has become political and controversial and whatnot. So if a parent feels like maybe their pediatrician is not a safe space to ask these questions to, where can they go? What are good resources for them to ask these questions and feel like they're getting honest, reliable answers so they can feel like they're making an informed decision for their children instead of being shamed maybe for even having the questions?
I'm just going to have them come and talk to you because that was so eloquent how you put that.
Yeah, but I don't know the answer either.
You know, there are situations, unfortunately, where parents will say that we don't feel comfortable talking to this specific healthcare professional because of everything you said. I think there's a separate issue there in terms of healthcare professionals opening up and saying parents out there are trying to do the best thing they can for their kids. It is not their fault if there's headlines everywhere across different news channels and social media giving them mixed information. Parents should be encouraged to find a healthcare professional who will listen to them and talk to them, or make sure that they're going online and they're going to reputable sources and they're getting good information, making sure they're always looking at the source of what posts they're reading, of what blog article they're reading, and making sure that that is something that is in line with scientific recommendations. And I hope that we have more resources out there to reach these parents, because in that same survey we keep talking about, done in April, 56% of parents said that at that time they didn't have enough information to make a decision about whether or not to get their child vaccinated. I hope that number is way lower now that it's been 2 months and we have information coming out there.
And then you talk about specific situations. So you have the parent that says, well, my kid just had COVID, so what do I do about that?
Well, the recommendation is still to say that if your kid just had COVID, to go out and get the vaccine anyway. Now, the thing about natural immunity is absolutely real. We have multiple studies showing that it offers good protection. There is no way to really quantify it. There's no way to say that your child had COVID. This is the amount of antibodies your child has. This is how long it'll last, because we don't know when exactly the infection was. We know that more severe infections of COVID-19 produce more antibodies. So it's just hard to give a blanket statement. And once again, that hybrid immunity, meaning if you previously had COVID and you get a vaccine, that gives you robust, long-lasting, broad protection.
All right, Dr. Patel, always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.